Hello guys, welcome back. So this is going to be the eighth part of our RRB MCQ series. So till now we have completed our 7 parts and discussed around 70 questions which have been previously asked in railways examination, and we are continuing further this series. So let's begin. So the first question here of this part here is that the recommended daily intake of protein for hemodialysis patient is. So the first option says it is 1 gram per kg per day. Option B is 1.2 gram per kg per day. Option C is 0.6 gram per kg per day, and option D is none. So since we are talking about hemodialysis, so the major difference between hemodialysis and CKD and the intake of protein is that when the patient is on hemodialysis, there is higher tendency of losing protein while the patient is on dialysis. However, when the patient is on CKD, we generally uh, go with the preventive therapy. So we restrict protein diet in such patients. So in CKD patient, it is around 0.6 to 0.8 grams per kg per day, but in HD it is generally 1.2 gram, and for a normal person it is always around 1 gram per kg per day. So this way the answer will be option B. So hemodialysis patients lose amino acids during dialysis and have increased catabolism. Therefore, protein requirement is higher than normal adults, and it is around 1.2 gram kg per day. Moving ahead, the second question says formation of anti-N antibodies is associated with which of the following solution used in dialysis reuse? So option A is glutaraldehyde, option B is acetylcysteine, option C is formalin, and option D is renalin. So the right answer is renalin. And now why renalin? Parasitic acid based disinfectants such as renalin used in dialysis reuse can lead to the formation of anti-N like antibodies in some patients. So that's why whenever the examination whenever you are in examination and the question asks about anti-N antibodies formation, your answer will be renal. Moving ahead to the third question of this series, it says which of the following is not a phosphate binder? So we have savumer, lanthanum, calcium carbonate, and potassium carbonate. So it is asking which one is not a phosphate binder. Now we know this is a phosphate binder, this one is a phosphate binder. Potassium carbonate and calcium carbonate are the two things that you might get confused in, but the right answer will be potassium carbonate. Potassium carbonate is not a phosphate binder. Calcium carbonate is a potassium binder, a phosphate binder, sorry, but potassium carbonate is not. Savumer, lanthanum, and calcium carbonates are all phosphate binders used in CKD, but potassium carbonate is not a phosphate binder. Moving ahead to the fourth question, it says the action limit for colony forming units in product water as per ARMY guidelines or ARMY standards of water quality for hemodialysis is. So here the examiner or the question is not asking about the standard ARMY standards directly, it is asking for the action limit. So it is very important to note here. So the answer will not be 100 here since it is asking action limit, so the answer will be 50 CFU per ml. So let's see what's the explanation. So explanation is as per ARMY standards for dialysis water, the action limit for a bacterial count in product water is 50 CFU per ml. Maximum allowable is higher, but action must be taken at 50. So whenever uh, it touches a threshold of 50 CFU, we have to take measures in order to correct the water quality. Moving ahead to the fifth question. So the fifth question says, what is the function of lipase? Lipase is an enzyme. So I think maximum will know what is the function of lipase. So let's see what the options are. So first option is breaking down emulsified fats, option B is respiration, option C is detecting taste, and option D is digesting proteins. So lipase is related to fats. So the answer will be breaking down emulsified fats. So lipase is a digestive enzyme that breaks triglyceride into fatty acids and glycerol and helps in fat digestion. Moving ahead to the sixth question, it says the primary cause of anemia in CKD is. So we have to find the primary cause of anemia in CKD. So the first option is erythropoietin deficiency, option B is iron deficiency, option C is blood loss, option D is folate deficiency. So what will be the primary cause? So the primary cause for for an anemia mainly is erythropoietin. Since the kidney produces erythropoietin, in CKD, reduced EPO production is primary cause of anemia more than the iron and folate deficiency. So here we are talking about the CKD, and for CKD the primary cause will always be EPO deficiency because the kidneys are not able to perform their function properly. Moving ahead to the seventh question, it says the following are cystic diseases of the kidney except, so we have to find the exception here. So the first option says autosomal recessive polycystic kidney disease, option B is Alport syndrome, option C is tuberous sclerosis complex, option D is autosomal dominant polycystic kidney disease. So what will be the answer? So the answer will be Alport syndrome. And why Alport? Because Alport syndrome is a hereditary nephritis affecting the GBM, that is glomerular basement membrane. It is not a cystic kidney disease, so it does not form cysts in the kidney, whereas others are associated with the cyst formation. So apart from Alport, every other disease cause cyst formation in the kidney. So the right answer will be Alport syndrome. Moving ahead to the eighth question, it says amino acid loss during each session of hemodialysis ranges from. So here they are asking us the amount of amino acids that we are going to lose during one particular HD session. So the option 1 is says 2 to 4 grams, option B says 6 to 8 grams, option C says 10 to 12 grams, and option D says 4 to 6 grams. So we generally lose around 6 to 8 gram of amino acids uh, during one particular HD session. So during one HD session, about 6 to 8 gram of amino acids can be lost into dialysate, contributing to higher protein requirement. That's why also the general uh, diet of protein intake that is suggested to patients is around 1.2 gram or more per kg per day. So suppose if you are weighing around 60 kg, so the amount of protein that you need to take will be around 72 grams of protein you need to take every day if you are on hemodialysis. Moving ahead to the ninth question here, it says acute pyelonephritis is what? It is a protozoan infection, it is a fungal infection, option C says it's a bacterial infection, or option D is it's a viral infection. So pyelonephritis is mainly a bacterial infection. So let's see what's the explanation. Here it says acute pyelonephritis is most commonly caused by bacteria, especially E. coli. So it is also important. Sometimes they ask what is the most common bacteria that cause pyelonephritis. So in that case, you have to answer E. coli. And it generally ascend from urinary tract. So it ascend towards the kidney from the urinary tract. So the bacteria keep on making their colonies and ascends toward the kidney, and finally when they reach the kidney they infect, and this is called as pyelonephritis. Moving ahead to the 10th question of this part, and the question says dash are 10 to 25 small openings that represent the distal end of the collecting duct. So here they have told us that we have to name that particular part, and they are 10 to 25 in number with small openings that represent distal end of the collecting duct. So it is asking us the distal end of the collecting duct, and they are 10 to 25 in number. So the first option is vasa recta, option B is a duct of Bellini, option C is renal pyramids, and option D is loop of Henle's loop of Henle or Henle's loop. So the right answer will be duct of Bellini. So the duct of Bellini are terminal collecting ducts that open at the renal papilla. They form 10 to 25 small openings at the tip of each renal pyramid. So this was all about this part. We have discussed around 10 questions, and all these 10 questions have been previously asked in RRB, I guess in the year 2019. So do practice more and more questions. The practice sheet of this video part will be available in our Telegram group. Try to practice as much as question, because practice matters a lot. Make sure you like this video, and do share it with your friends. Thank you. Have a nice day.